Thank you for reviewing your 2016 Employee Benefit Program through ARA. Open enrollment will be held from November 16th to December 4th, 2015. Unless you make changes, most of your current elections will continue in 2016, with some exceptions. Your medical and dependent care flexible spending accounts will require you to re-enroll. You must log into UltiPro and make elections between November 16th and December 4th if you plan to change any of your elections, change any of your covered dependents, continue your flexible spending accounts for medical or dependent care, or newly enroll in the flexible spending accounts. Employees who want to make changes to your HSA payroll deduction must do so through tangohealth.com, not through our open enrollment session in UltiPro. Please be sure to select January 1st, 2016 as a desired date on the Tango Health site so that the action does not take effect until the first payroll in January. The elections you make during open enrollment will go into effect on January 1st and stay in effect till December 31st, 2016. And you can't make any changes to your elections throughout the year unless you experience a qualified life event. Those are listed here. If you experience a qualified life event, you need to contact HR within 31 days of that event if you want to make a change, because if you wait beyond that, then you lose your opportunity until next year at open enrollment. If you do not change medical plans, you may not receive a new ID card. You will receive a new ID card from Caremark for your prescription drugs, and we will have a new RX Benefits customer service number. You'll automatically receive new benefit cards when you sign up for a medical plan for the first time or when you change from one plan to another. If you sign up for the Medical Flexible Spending Account for 2016 for the first time, you'll receive a debit card from Infinisource. You're eligible for benefits if you're an active employee working 30 hours per week or more, and you may enroll your eligible children in the benefits in the chart up to the ages shown in the chart. But keep in mind, you may be required to submit an affidavit and documentation that supports your relationship to the dependent. Any changes that you want to make to your voluntary life insurance or your short-term disability coverage must be communicated via email to Chris Art by December 4th. This applies to you only if you're changing, adding, dropping, increasing, decreasing your voluntary life coverage, or if you're adding or dropping short-term disability. What's not changing for 2016? Well, ARA will continue to offer 2 HSAs and a PPO plan option through United Healthcare. ARA will continue the current contributions to your health savings accounts. If you waive medical coverage, you'll receive $100 a month, and if you waive dental, you'll receive $21.66 a month. Keep in mind, if you are also covered under your spouse under the ARA plan, you don't get this monthly credit. CVS Caremark will continue to be our prescription provider, and Guardian will continue to provide our dental and vision programs with no changes in benefits or cost. If you need assistance with your UltiPro login, please call HR at extension 7220 or the IT Help Desk at extension 7227. Hartford will continue providing our life and short-term disability insurance with no change in benefits or cost. And remember, any changes that you make to your voluntary life insurance coverage or short-term disability coverage must also be communicated via email to Chris Art by the last day of open enrollment. Again, this applies to you only if you're adding, dropping, increasing, or decreasing your voluntary life coverage, or if you're adding or dropping short-term disability. Infinisource will continue to administer medical and dependent care flexible spending accounts, and Tango will continue to administer the health savings account. Enrollment will be online through UltiPro, and you can get to UltiPro from SharePoint by clicking on the Human Resources tab, or from home by typing in the URL located here. If you need assistance with your UltiPro login, please contact HR at extension 7220 or the IT Help Desk at extension 7227. What is changing for 2016? We will see modest medical plan benefit changes on all 3 plans. We will now have an embedded deductible on the HSA plan. What an embedded deductible means is that each individual person will have their own individual deductible, and if you're covering multiple family members, then each person is protected at that individual amount. But you will have an overall maximum for your family that you'll meet, but it will no longer be a family deductible. Each person will have their own individual deductible. We're also adding new clinical programs and resources for you to add value to your family and to your health. Teladoc will be a brand new benefit for all members of our employer-sponsored health plan. Your service email is changing. It's helpline@higginbotham.net, and the service number is 1-844-857-5903. We're also making some changes to our pharmacy program. You will now have the ability to purchase a 90-day supply at retail at CVS pharmacies. This is a new option, and you can still use mail order if you prefer. Also, you can save money when you choose generic medications. But please note, if you request a brand name drug, when a generic is approved by your doctor, you're going to be paying the brand name copay plus the difference in the cost between the brand and generic. CVS Caremark ID cards are going to change because you're going to have a new RX Benefits customer service number. You'll see a modest increase to your medical premiums, and the IRS limit for your flexible spending account has increased to $2,550. We are changing our EAP from IEAP to Benzinger DuPont. Your service email again is helpline@higginbotham.net, and the service number is 1-844-857-5903. A high-level overview of the medical plan changes is listed here. On Medical Plan 1, you'll see that your plan deductible will remain the same, while your out-of-pocket maximum is increasing. Copays are going to apply for some services after you meet your deductible, until you reach your out-of-pocket maximum. Medical Plan 2, the plan deductible and out-of-pocket maximum are increasing, and the plan will start paying 20%, or you start paying 20% after you meet your deductible until you reach your out-of-pocket maximum. On Medical Plan 3, which is a PPO, the deductible and out-of-pocket maximum are increasing. After you reach your deductible, the plan will pay 80% and you pay 20%, and copays will continue to apply to prescriptions, office visits, specialists, ER, and urgent care. A new benefit this year is that we'll have access to Teladoc 24 hours a day, 7 days a week, 365 days a year to Teladoc's board-certified doctors to resolve medical issues. These are your 3 medical plan options for 2016. As a reminder, your deductibles on the high deductible health plan are embedded, meaning that each individual, if you're covering multiple family members, will be capped at the individual level. And then you have overall protection for your family at the family level. All the changes to your plans are highlighted in yellow. For the 2850 plan, you can also open a health savings account, and your deductible embedded is $2,850, but no more than $5,600 for your family. Your medical out-of-pocket maximum is protection for you in case you have catastrophic loss. So if you have a major medical incident, you'll pay no more than that $4,000 for an individual in a calendar year, or $8,000 for your whole family. There's no limit to the benefits that you get from your plans, and your coinsurance on the 2850 plan is 100%. One of the changes this year is when you go see a primary care doctor, you will have a copayment after you meet your deductible. That copayment will be $30, and if you see a specialist, that copayment will be $50 after you meet your deductible. For hospitalization, outpatient surgery, lab and x-ray, all of those things, you won't pay anything once you meet your deductible. The emergency room facility will require a $250 copay after your deductible, and urgent care is $75 after your deductible. Your prescription drugs this year will also be a copayment after you meet your deductible. Tier 1 is generic, Tier 2, Tier 3, and Tier 4 will all have different copay amounts. $10, $30, $50, or $100. If you utilize mail order, then you'll pay twice the cost after your deductible. And if you go out of network, you will be paying more out of your pocket in a couple of ways. When you see an in-network provider, they've agreed to a certain price with United Healthcare. United Healthcare will be reimbursing based on that eligible charge. So if you go out of network, you'll not only be responsible for your cost share, but also the difference in the eligible charge and what your non-network provider charges. On the HDHP 1500 plan, your deductible will be increasing to $1,500 embedded for each individual in your family, but no more than $3,000 for your entire family. Your medical out-of-pocket is $5,000 for an individual, or no more than $10,000 for a family, and your coinsurance will be changing to 20% after your deductible. You still have your same copayments for your prescription drugs, and your out-of-network benefits will be changing slightly, as you can see here. On the PPO plan, your deductible is still $1,000, no more than $2,000 for a family, and your out-of-pocket maximum is $3,000, no more than $6,000 for a family. Your coinsurance will change to 20%. Your out-of-network benefits will change. You'll see a $2,000 out-of-network deductible and $4,000 for a family, and a $6,000 medical out-of-pocket maximum for an individual and $12,000 for a family. And the out-of-network coinsurance will be 30%. HSA plans have special tax advantages that accumulate funds to cover healthcare expenses. Because of the tax advantages, the IRS actually has specific rules on who's able to open and contribute to an HSA. In order to be eligible to contribute towards a health savings account, the IRS requires that individuals must be enrolled in a qualified high-deductible health plan, which would be your HSA 2850 or 1500, and you cannot be claimed as a dependent on anyone else's tax return. You can also not have any other health coverage, so you can't be covered by a spouse's medical or pharmacy plan, and you can't be covered through Medicare Part A or Part B. Also, you cannot be covered through a general purpose flexible spending account. You can only use a flexible spending account for dental and vision expenses. Benefits of the HSA are you make tax-free contributions, and the accumulation belongs to you. It's your own personal account. You have tax-free growth, and there's no use it or lose it rules like there are with other tax advantage accounts. You can also take tax-free disbursements to pay for qualified expenses, and those eligible expenses are defined by the IRS in Publication 502. The 2016 maximum amounts that you can contribute to an HSA from all sources, including ARA's contributions, are $3,350 for an individual or $6,750 for your family. If you're 55 or older, you can make a catch-up contribution of $1,000, and you can do that in the year when you turn 55, regardless of when you turn 55. ARA will contribute the following into your HSA. They will be broken down by pay periods, but your annual amount that ARA will contribute is $950 for employee-only coverage on the 2850 plan, and $1,850 if you're covering any family members. On the $1,500 HSA plan, ARA will contribute $500 for employee-only and $1,000 if you're covering your family. Keep in mind, penalties will exist for non-qualified purchases, and those under age 65 who use HSA funds for non-qualified medical expenses face a penalty of 20% of the funds. And they're also subject to income tax. Tango is the HSA administrator and provider. You can actually start, stop, and change your funding at any time during the year, and you can fund your account after the fact through April 15th the following year. Money in your HSA can be used for any tax dependent, even if they're not covered on your medical plan. And you can list your credit cards with Tango, and they'll actually scan your accounts automatically, logging any eligible expenses. Use your smartphone to take a photo of your receipt and upload them right into Tango. If you're enrolling in the HSA account for the first time in 2016, you will need to be registered for your account and sent an email with additional instructions that will allow you to open your account. Please be sure to complete this process by the end of December to ensure your account is open successfully before January's first payroll date. If you don't complete that HSA application process, ARA will not be able to deposit any funds into your account. Teladoc is a new service this year. There is no cost for you to use this service. You can access a doctor 24 hours a day, 7 days a week. Once you're enrolled in United Healthcare, you will automatically receive welcome kits and cards with instructions on how to get started. But it's very simple. You go online and complete a medical history. When you need a consult, you just request the consult, and then the physician will call you back, and you talk with the physician. He diagnoses your issue, and if there's something he can do, prescribing a prescription and getting that sent to your pharmacy, they will do that for you at that time. For continuity of care purposes, I'll ask if they can give this information to your primary care doctor, and there will be no cost to you at the end of this process. You can call them any time of the day or night, 24/7, 365 days. When your physician is not available, when they don't have any appointments, if it's after hours, instead of going to urgent care or the emergency room for non-emergent situations, call Teladoc. Even if you just don't have time to go to your doctor because of travel or your workload, you can call Teladoc. When you're on vacation anywhere in the United States, you can call Teladoc and get care. They can also refill recurring prescriptions on a short-term basis in the event you leave home on a short time frame and you forget your medications at home. You can also use this for pediatric care. They give effective resolution to a wide range of conditions. And best of all, there's no cost to you or your covered dependents to use this service. Some of the most common diagnoses that they handle are for sinus issues, urinary tract infections, pink eye, bronchitis, upper respiratory infection, nasal congestion, allergies, flu, cough, or ear infections. When you need prescriptions, they have the best practices in prescription management. They follow appropriate prescribing guidelines through the CDC. They will not prescribe any controlled substances, psychiatric or lifestyle drugs. They have a 98% generic prescribing rate in order to save you the most money. And they have convenient e-prescribing and can send it to the pharmacy nearest you. There's a few things that you need to do if you're not enrolled in a flexible spending account and you don't want to make any changes to your benefits. You don't have to do anything. If you want to continue a flexible spending account, you must log into UltiPro and make your 2016 election by December the 4th. If you want to make changes to your benefits or cover dependents, you must log into UltiPro and make those updates by December 4th. And remember, if you're making any changes to your voluntary life insurance coverage or short-term disability, you must also email Chris Art by December 4th and let her know of those changes. This applies to you only if you're adding, dropping, increasing, or decreasing your voluntary life coverage, or if you're adding or dropping short-term disability. And remember, you can get to UltiPro from SharePoint by clicking on the Human Resources tab, or you can access it from home or anywhere where you have internet by typing in the URL listed here. Thank you so much for participating in this online presentation. If after this presentation you have additional questions, we're posting materials on the HR benefits page on SharePoint, and you can always email helpline@higginbotham.net, or you can call the new service number at 1-844-857-5903. Thank you and have a good day.